John and Ken Show, John Cobelt, Ken Shampoo, KFI, AM 640, live everywhere on the iHeartRadio app.
All right, we have a chance now to talk to probably a person that is the busiest of any local public official position that we can think of in Southern California. It's the L.A. County Director of Public Health, Dr. Barbara Ferrer. So let's bring her on and get ourselves an update of what's going on in the county and elsewhere.
Doctor, thanks for coming on with us.
Thank you so much, John and Ken, for having us. And sorry for the delay today.
No, that's all right. There's so much confusing news about the test kits and whether you're able to use them properly. What's the status of the testing in L.A. County?
So right now here in L.A. County, to date, between us, which is the Public Health Department's lab, where we've tested 100 people, and that, is in sort of the last 8 days. The federal government at the CDC lab, they tested 27, and the last couple of days we've really benefited from having commercial labs who have tested approximately 120 people. I can tell you that those are the folks who have been tested as of yesterday. That's the numbers. Those are the people who we know the results from. Moving forward, the commercial labs anticipate that they'll be able to increase their capacity, and we're looking forward to that. I know that UCLA is planning on being able to set up a lab at their hospital for their patients, and that will be helpful. The county hospitals are also looking at having capacity at their hospitals to do the testing. So, my hope is that over the next, few days, we start seeing the increased capacity that everybody so desperately would like us to have in the county. We're never going to be the biggest lab in the county. We're a public health lab. We also have to test for a lot of other public health diseases in our lab. And so having the commercials come on board is enormously beneficial to everybody in the county. I've also heard from sort of a concierge service that's being offered in some places where there's a person who's offered to come out and collect lab specimens at your house. Again, I think those are just sprouting up. I'm not really sure how well they're regulated, but I think they're in demand to people saying, I really want to get tested. How can that happen? That concierge service is, I believe, willing. If you pay enough money, they'll come and pick up a lab to take a lab specimen. They'll send it to Quest. But again, that's only for people who have a lot of money, and I'm not even sure who's doing it and how it's being regulated.
Do they all report to the same database?
Every single lab has to report to us. So that's the one assurance I think the listeners really want to make sure we have in the county is that, if there's a positive result, I know about it because I'm the department that's in charge of both making sure that people who are positive are isolated and that we get a list of their close contacts so that those people can be quarantined. So this would all fall apart if the labs didn't have to. They weren't mandatory reporters to our lab, but they are. So everybody, no matter whether it's a commercial lab or private lab at a hospital, when they have a positive result, they do need to report it to us, and then we do the interviews and the follow-up with both positive cases and close contacts.
Should people request a test even if they have or feel they have a common cold?
I don't think so. I always tell people, I'm not your doctor, though, and you should always talk to your doctor if you have doubts. I mean, we have limited capacity, as I've just noted, and it's really important that people with serious illness who meet the clinical criteria for needing to be tested are able to get tested, and we're able to get them their results expeditiously. So I'd urge people, if you're asymptomatic, you have no symptoms at all, or you just, you have allergies every year at this time, and you're like, well, maybe I should get checked out. You probably, if you had allergies last year at this time, you probably have allergies this year. But if you have a doubt, talk with your provider, and your provider and you can make the best decision about whether you need to be tested.
What is the cluster of symptoms that would compel you to get tested? Because everyone I talk to has a different idea of what the symptoms are.
Oh, that's a good question. So for certain, these are the symptoms that would really make it essential that you got tested. You have serious respiratory illness, and that's with a fever that's well over 100.4. That's really that you're running a fairly significant fever. You're having trouble breathing. You have a very productive cough, and you're not feeling better. You're actually starting to feel worse. It's especially important if you're a person who has underlying health conditions to pay attention. If you do have what we call serious respiratory illness, for example, you have asthma, and all of a sudden you're starting to have more and more problems breathing, and you're running a fever. That's a sign for you to call your doctor and for you and your doctor to figure out if you need testing. But that's what we mean by respiratory illness, a lot coughing with productive coughing. And
productive means what?
It means generally that there's junk.
Phlegm?
I don't know how else to say it. It means that you've got. It's not just sort of your little cough, like it's like a productive, heavy cough.
Right.
And often it's frequent. And for many people, it's not just sort of it's been like a couple hours. It's really gone on for a while, and it's making it hard for you to breathe and talk and sleep. That kind of a serious cough. But again,
so
I never want people not to call their doctor.
It's a little different from having a head cold where you have nasal congestion.
It's very different. This is sort of respiratory illness, so it's really a fever accompanied by problems breathing. It hurts when you breathe. You're having a lot of coughing, that you're having what we call some respiratory distress here. And again, for us, an exposure history is also important. So if, for example, you start developing symptoms and you've been a close contact of a person who is a confirmed case of COVID-19, you need to call your provider right away because you do need to be tested right away. And this is especially true when we quarantine people who are close contacts. We say at the first sign of symptoms, call us, because we would start testing you. We would test you right then and there. The other group that's really important for us to test right now are people who are hospitalized. They have serious respiratory illness, and there's no other explanation for what might be causing their illness. So, you can run lots of different tests to see whether they have flu or some other respiratory illness. But if those tests are all coming back negative, then that's also, even if there's no known exposure, that's a time for that person to be tested for COVID-19.
Dr. Ferrer, one last question before we let you go. And in the last 24 hours, it's all been about cancellation, social distancing. Explain to our audience and John Cobelt why this is going to be important in the long term.
As much as social distancing is going to hurt us, both, emotionally, but also for many people financially, it's absolutely what we need to do at this point in time. We don't have a vaccination available for novel coronavirus COVID-19, and the only tool that we have that allows us to protect each other is social distancing, which really means that we're avoiding being in places, going to places, or holding events where there are going to be large numbers of people, some of whom may be infectious and spreading disease to each other because they're in a large event where it's almost impossible for people to keep a lot of distance from each other. We want to avoid that because, as I've explained, with this disease, every person who gets it is easily capable of giving it to two other people. So the less people that have it, the less people are going to get it, and the less people that are going to get it, the better off we are in protecting those who are most vulnerable for serious illness and even death. But also what we say is when you have less cases, you can get to a resolution of an outbreak much quicker.
All right. We appreciate you taking the time to talk to us. I know you're very busy. Thanks for coming on.
No, thank you for having me.
All right. Dr. Barbara Ferrer, the LA County Director of Public Health. More coming up.